the last 24 hours, we have identified 663 new cases and completed about 8,000 tests. Our positivity rate was about 8.8%. That is good news, but we must continue to watch closely as a single day's numbers are less important than overall trends, and the coming days will be critical to determine what those trends are. Currently, 1,094 people are being treated for COVID-19 in hospital, including 252 in the ICU. I am saddened to report that 26 more deaths were reported to Alberta Health in the last 24 hours. My condolences go out to their loved ones and to anyone who has lost a friend or family member during this difficult time. Currently, those between the ages of 5 and 19 make up about a quarter of our active cases. To be clear, children who contract COVID-19 are still at a much lower risk of severe outcomes than adults. As of October 3rd, only about 1% of COVID patients in hospital are under 18 years of age, and less than 1%, only about 0.8% of ICU admissions are in youths. I do not say that to minimize the risk, as the percentage does not matter to those who have a loved one in hospital. However, it is important to reassure parents that even with our current numbers, there is a low likelihood of children becoming severely ill. We do know, though, that children can spread to others around them who may be susceptible to severe illness, including those in households. The current rate of high case rate requires special measures to help reduce transmission. We are focusing on schools right now because of the sharp rise in school-age cases and the challenges involved in preventing transmission.
With the support of Alberta Health Services, we are initiating contact notification in schools across the province in a phased approach. School authorities will support an interim process for contact notification. This will begin after Thanksgiving on October 12th. We will be supporting school authorities as they determine close contacts of individuals who were infectious while attending school, and they will notify families of those close contacts. To help schools through this interim step, we will provide new guidance and share more information on alberta.ca/return to school. Over the long term and by mid-November, AHS will take over notifying parents of contacts within school settings. School authorities will help this AHS team to identify close contacts and will focus on school-based exposures only, such as identifying classroom contacts and close contacts through participation in school sports or extracurricular activities. Contact notification will not extend to positive cases, community activities, or out-of-school contacts. In kindergarten to grade 6, we will offer a targeted rapid test program for schools experiencing outbreaks of 10 or more cases of COVID-19 that were infectious while in school. This will give us another way to protect our youngest children who cannot yet be vaccinated by offering a screening tool for individuals who are asymptomatic. Every student and staff member at these schools will be able to access tests for free if they want to take part. This will give peace of mind to students, to families, and to staff. I strongly encourage every school authority to require proof of vaccination or a negative PCR or rapid COVID test for all adults who enter a school, including staff. Minister Copping and I will be sending a joint letter to school authorities this afternoon, and we will be posting this communication online for Albertans to see. I want to be clear, this does not include students. A school authority cannot deny students access to education due to their immunization status. But I do hope that everyone who is eligible gets their vaccination as soon as possible.
Today, I am announcing that effective tomorrow, Alberta will be expanding the vaccine rollout in an important way. Starting at 8 a.m., all Albertans who are 75 years of age or older and all First Nations, Inuit, and Métis people age 65 and older will be eligible to book appointments to get a third booster dose of vaccine. We're asking them to book these appointments as soon as 6 months has passed since their last dose. This change is based on the advice of the Alberta Advisory Committee on Immunization, and it means that more than 150,000 Albertans will be eligible for booster shots by the end of October. The measures that we put in place several weeks ago appear to be having a positive impact. We've seen active cases plateau recently, and they now appear to be declining somewhat, with the R rate last week dipping below a level of 1 for the first time in more than a month. This is certainly encouraging news, but the situation remains very serious. Our cases are amongst unvaccinated Albertans in particular. We see case growth amongst children from the ages of 5 to 11 years of age, especially in regions with low overall levels of vaccination. And that is why, acting on the recommendations of the Ministers of Education and Health, we are announcing new measures today to help to slow and prevent transmission at schools. We're taking action to protect students, school staff, and school communities while supporting vaccinations as the best defense against COVID-19.